Hello and a very good morning, good afternoon, and good evening to all of you. And thank you for joining us today for our webinar on monitoring and evaluation frameworks in National Action Plans on AMR, a capacity building workshop. We, on the behalf of South Center Geneva, we are thrilled to have you on board with us. I am Dr. Afrina Shamir, and I'm going to moderate today's session with you. So the background is that we have seen that countries, they have endorsed the global action plans and they are working on their AMR action plans. And the majority of the countries, they have completed their initial 5 years plans. And now they are reviewing the implementation progress and they are developing the second national action plans. So the workshop, it aims to engage the countries in sharing their experiences and perspectives on the implementation of the first action plans and how they are looking at their development of the second national action plans. And the key observations that we often see is that the initial NAPs, they lack the accountability mechanisms. Like what we have seen is that the targets particularly for the monitoring and evaluation frameworks, they are not highlighted or being mentioned. And many of the countries, they are still struggling to develop the M&E frameworks and identifying the targets. But fortunately, WHO, they have developed a number of the guiding documents to support the countries in implementing their national action plans. These resources, they include a stepwise approach to implementing national action plan in the human health sector. And again, we have seen a very good document on that facilitates the monitoring and evaluation for AMR national action plans. So with this background, we aim to conduct this workshop to facilitate our countries to understand the dynamics. And I'm very happy to share that we have the privilege of hosting experts in the field, and they will share their valuable insights and experiences. So first, I can begin with, I'm not sure Dr. Viviana is here or not. Let's see. I was just waiting for Dr. Viviana for her welcome remarks. She is the head program at South Center, but she has not joined yet. But we will wait for her remarks later on. And quickly, I'll go walk you through the agenda. We are going to have two discussions, both from WHO Geneva on the national action plans on AMR and monitoring and evaluation frameworks. We are going to have 3 short presentations from our countries who have done with their National Action Plan 1, and they are moving towards the National Action Plan 2, and they can share their experiences on the M&E frameworks. And then we have a panel discussion with our experts. So to begin the session, our first speaker for today is our very own Dr. Sarah Pauline. She is the Technical Officer on AMR in the WHO Department of Coordination and Partnerships on AMR within the WHO AMR division. And she has been instrumental in a number of activities, including the antimicrobial R&D priority setting, antimicrobial stewardship initiatives, and developing the practical toolkit for AMS programs in the healthcare facilities. And we are very happy to have Dr. Sarah with us today. Over to you, Dr. Sarah, for your presentation.
Thank you, Afanish. Can I just check that you can see my screen?
Yeah, I can see the screen.
Thank you. Well, first of all, thank you so much, Afanish, and to the South Center for hosting us in this wonderful workshop and the opportunity to present on the WHO Implementation Handbook for National Action Plans on Antimicrobial Resistance. And we really hope that this will aid countries somewhat, at least in the process, when it comes to revising the national action plans as they move to NAPs 2.0 and 3.0. My name is Sarah Pauline, and I'm in the AMR division at WHO headquarters. So I'll try to be relatively short, and I hope the presentation can be shared with all participants afterwards, as there's also some very nice links. So just to give a background, is that currently, and this is really a lot of the data coming from tracks from last year, is that we now know that about 170 countries have developed national action plans on antimicrobial resistance, be it that some of these national action plans are already in version 2 or version 3. But what we also see when looking at more of the concrete data from tracks is that implementation is often fragmented, it's ad hoc, siloed. We do see, and I think this is very positive, that 64% of countries are implementing some aspects of their national action plans. But we also see that only 28%, you could say, are actually effectively implementing and monitoring national action plans. So I think this very much goes to what you were also saying, Afrinish. And only 9% are actually providing specific funding, a national budget line for AMR activities of their national action plan. So we do still have a long way to go in really thinking about sustainable implementation of national action plans and the operational plan with activities. And a few years ago, WHO released this guidance, the WHO Implementation Handbook for National Action Plans on AMR, really with the focus on human health, because this is the mandate of WHO, but acknowledging, of course, this is as part of multi-sectoral national action plans on AMR. And what it provides is a 6-step continuous process that we feel is needed to really try to get the national action plans to be a bit more sustainable. First, and very important, is to strengthen governance, and I'll go into more detail in all of these steps in the subsequent slides. Secondly, and something that is now starting to be used more and more, is really to prioritize activities, to move from a longer laundry list of activities really to what needs to happen now in order to allow further activities to continue, or what will have the biggest impact, etc. Then to actually cost the operational plan, to then be able to identify and mobilize resources to fund the activities, to then sustainably implement the activities, and last but not least, importantly, to monitor and evaluate. And then you go back up to the front and you reprioritize based on your monitoring and evaluation. And this publication has really a lot of concrete stepwise guidance, a collation of tools, and also a checklist for each of these steps. But let me just briefly go a little bit further into each of the steps. Now, I probably don't need to remind everyone that, of course, AMR is complex. It cuts across sectors, it cuts across ministries and departments, because the drivers and impact of AMR really are really broad, cross-cutting. But what I'd like to just say here, and this is really related to human health, is that when you just think about the drivers and impact of AMR and who you really need to be including in your governance structures, in human health, you already need to think about some activities that might be taking place in universal health coverage and primary health care, actors in emergencies, in perhaps the Ministry or Department of Education, in the FDA or regulatory authorities, immunization, and so on and so forth. So it's really a multitude of players that need to be brought together. And this is why it's so important to have strong governance, coordination, and collaboration, who are able to bring all these different players together, and also importantly, monitor the activities that will be taking place in many of these different departments and ministries. So here, the first step really is to establish a national, and in many countries, a subnational or federal governance structure. And here is just one such governance structure, where we start really at the core, and I hope you can see my mouse, is having a national or subnational AMR multi-sectoral coordination mechanism. This is really the heart of the AMR National Action Plan, and being able to prioritize, implement, and monitor activities. That often needs a dedicated AMR secretariat to function. What's important is that they need to be accountable to a higher entity, such as an interministerial committee. This is often an interministerial One Health committee, for example, who then are accountable higher up, for example, in many countries, to the president or prime minister's office. They also need to liaise with other existing committees that are relevant, such as the National One Health Committee, the National Committees for HIV, TB, Malaria, or UHC, PHC. This is just a few examples. And of course, each country context is different. And under the multi-sectoral coordination mechanism is then really to think about establishing, if you haven't already, technical working groups with very specific terms of reference for implementing the different areas of the National Action Plan. So this, again, is very context specific, but for example, having a technical working group on awareness and education, on AMR surveillance, and so on and so forth. Some will be sector specific, and others might be multi-sectoral, such as integrated surveillance. And most importantly is also to allocate some level of financing, it doesn't need to be a lot, to the actual functioning of this multi-sectoral coordination mechanism. Often it's providing partial staff time to the AMR Secretariat. As we know, often a full-time staff is just not feasible in this situation. Then second step is to prioritize activities. When you have a long list of activities, everybody has their wish list of what they would like to do within the human health sector and also in your multi-sectoral partners, is to really review the current situation, have the evidence to be able to then prioritize activities. And here there's a different tools available in our publication, such as a situation analysis tool, an example of a SWOT analysis, stakeholder analysis, etc., to then be able to identify the activities for prioritization. And again, there's various tools in terms of activities at the national level that should be prioritized or could be prioritized, or at the facility level, such as stewardship and IPC guidance. And then thirdly is to prioritize based on a participatory approach and an agreed upon scope and approach, because there's quite a few different methodologies now being used to prioritize activities, which is great because that's really been sort of the weakest link often in national action plans and also in the guidance in general globally. But it's to agree upon that approach beforehand and then to have a participatory approach when prioritizing. And so here's just an example of a SWOT analysis, one of the ways to build the evidence-based to prioritize activities, looking at strengths, weaknesses, opportunities, and threats. And this can all be found in our guidance. I'm just going to go slightly quicker through this because there's a lot of information here, and you can then look at the document and our course later on. So once you have your list of prioritized activities, the next step is to cost the operational plan. So first is to develop your operational plan based on the activities. Importantly, is really to identify the implementing entity per activity or sub-activity. It gives the accountability as to who is actually going to do that activity, and also allows the multi-sectoral coordination mechanism to monitor its implementation. Identify implementation level, because implementation can be at the national level, subnational level, primary care level. So it's important to also identify that. Timelines, indicators, and I'll come to now the cost. There is a vast number of national action plans available in the WHO library of national action plans, which give a lot of good examples if you're looking for examples sort of to stimulate your thinking in terms of how you would like to develop your operational plan. And then to cost the operational plan, many of you may be familiar with the WHO costing and budgeting tool for national action plans on AMR. It's quite what we call, it's a fancy calculator that allows you to fill in your operational plan. You plug it into this tool, free for anyone to use. You then input a few basic inputs. We call it the building blocks. And at the end of the day, your output is the costs for that activity, be it HR costs, meeting costs, travel costs, procurement costs. It really has a wide variety of building blocks to try to really align with all the different type of activities a national action plan may have. You can also insert the funding that exists that you are aware of to ultimately also give you your funding gap. What is nice is that with this tool, we have a course available on the WHO Academy. The link I'll show you in a later slide, that really allows you to learn how to use the tool. It's really quite straightforward. We also do provide 3-day workshops to train anyone, any country in the tool to be able to cost your operational plan. And of course, once you know what your funding gap is, to mobilize the resources. And here's something we'd really like to stress is also to look at which activities may already be covered by other programs. For example, the health emergencies programs may be covering some of the labs or diagnostics aspect, or IPC, or universal health coverage and primary health care might be covering some of the rational use, which often is the antimicrobial stewardship program areas. So to already see what is being covered and what is your ultimate gap in funding, and then to identify potential donors and funders, really looking at domestic financing first, and then going outside, and then to discuss with potential funders and present a resource mobilization or advocacy or investment case. Here's just an example of what such a funders map could look like, giving example of national departments or agencies where there may be some funding lines, and also other developmental partners. And here's something I'd really like to stress is, and what WHO is really trying to do is support countries in linking the National Action Plan activities in the human health sector far more with the national health strategic plans, also because there's opportunities for financing of certain activities through the national health sector plans and budgets at the end of the day, and not to create silos and duplications. And finally, of course, before we get to M&E, is to implement the activities. And here there is a resource that was just recently published called the AMR Resource Pack, which tries to really capture all the existing guidances from WHO, but also all the implementing partners per strategic objective of the Global Action Plan, and now actually also aligned to our people-centered approach and the 13 core interventions. So if you're looking for guidance in terms of implementation guidance, this is a really exciting tool that is very comprehensive. And finally, to monitor and evaluate your National Action Plan. I won't go into depth because my colleague Pravasha will, of course, give you a full presentation on M&E, but just to say that it is vital to monitor progress, to analyze the progress, to disseminate the findings, and then to use those findings to revise the operational plan. And again, there's a WHO Academy course and also a workshop that takes place. And just a few more slides on some other guidances that we think are really useful when it comes to national action plans. Is you're probably aware of the people-centered approach and the WHO core package of 13 AMR interventions that was launched, I think now 1.5 years ago. And it really, what we as WHO, really in consultation with many countries and implementing partners, find to be the core package of interventions that all national action plans should consider based on context, thinking about activities in prevention, access to essential health services, timely, accurate diagnosis, and appropriate quality assured treatment, which are all, of course, underpinned by strategic information through surveillance and research, and effective governance, awareness, and education. And when you're looking to implement these activities, really think about the different implementation levels. Traditionally, national action plans have focused primarily on the national level, but we know that 80 to 90% of antibiotics are actually being prescribed at the primary care level. So that's also where we need to make sure that we are targeting some interventions also at primary care and community level. And here WHO will be providing guidance later this year on mainstreaming AMR interventions into primary healthcare, as we see a lot of interventions really need to start focusing there if we actually want to get to the crux of the issue. And of course, additional considerations is also thinking about gender equity and disability inclusion, private sector engagement, which is easier said, of course, than done, community engagement, not only in the design, but also in the implementation of your national action plans, mainstreaming into UHC and PHC I've already mentioned, and capacity building, training, capacity building, I think is really at the core. As we know, often those who are working in the multi-sectoral coordination committee will move on, and every time we get someone new in, we need to continuously build that capacity. Here are the 4 WHO Academy courses that exist at the moment on this particular guidance, on the costing and budgeting tool, on M&E, and on the people-centered approach. And with that, I'm going to stop here, and thank you very much for your attention. And I hope that the presentation can be shared with everyone. Thank you very much.
Thank you so much, Dr. Sara. It was really always a pleasure to listen to you and learn from your experiences. And we totally appreciate the great work on the handbook. And this is such a comprehensive approach that every country who wants to establish the NAP systems within their country, they have a very good understanding that each and every aspect is well covered. And I like the idea that there are a number of new areas that are being, they should be the part of the new national action plans, including the gender, the climate, and the other people-centered approaches that we were mentioning. Thank you so much for your time, and definitely we will seek your expertise in the question answer in the panel section as well. So with this, we move towards our country presentations part. We are going to have 3 short presentations, and first I would like to introduce Dr. Hiba Mahmood Dada. She is the Director of Antimicrobial Resistance, Public Health Authority of Saudi Arabia. She has been phenomenal in the work of AMR since quite a few years, and we totally appreciate her efforts. She was a consultant of medical microbiology at Public Health Authority, and she was working in Texas as a clinical and research microbiologist. And she's been working in the Prince Sultan Medical City as well. Thank you, Dr. Hiba, for joining us today. And we would like to hear from you the country experience that you have on the National Action Plan on AMR.
Excuse me. Thank you very much, Dr. Afranish, and thank you for inviting me to be part of this webinar. You can hear me well and you can see the screen?
Yeah, we can see the screen well and hear you well.
Okay, thank you very much. It's my pleasure to be here today. I'm gonna share our experience. It's actually 10 minutes is a very short time. So I pick up some of the highlights that highlight our experience in Saudi Arabia. My name is Data, and I'm in charge of the antimicrobial resistance on a national level. So in my outline, I will just start by giving you the history of the antimicrobial resistance multi-sectoral national action plan, as well as I'll take you through briefly through our operational plan. And the last thing that I'm going to be highlighting is the monitoring and evaluation of the National Action Plan. So as you can see in this picture, we started our activities of combating antimicrobial resistance even before establishing our first National Action Plan, where we have different related initiatives such as infection prevention and control, different individual initiative to monitor AMR trends in some institution. That was before 2017. In 2017, we had our first National Action Plan, which was comprehensive, putting all the efforts together to develop a multi-sectoral National Action Plan. That we had it from 2017 until 2021. These 5 years, we have established the building blocks of combating antimicrobial resistance in different aspects, including surveillance, antimicrobial stewardship, and different aspects. Then in 2021, we started evaluating our first National Action Plan. We did the situation analysis. We identify where are the gaps and challenges in implementing some previous actions. We engaged all the related sectors in that process. And then we had a plan to where can we fill these gaps and how can we improve our first National Action Plan. So in 2022, we released our second National Action Plan, which is we have been working on it and implementing it from 2022 until now. We actually had it for 40 years, and we're actually now even further looking for reviewing our second National Action Plan to actually have the update National Action Plan, the third National Action Plan, soon within next year. So in our National Action Plan, we have 5 objectives, 13 initiatives, 50 actions. Under each initiative, we have certain set of actions that we have developed, divided between different ministries and agencies and sectors. So these are our objective of the antimicrobial resistant multi-sectoral National Action Plan. We added one of the unique objective that we added in the second action plan, where we added strengthen and improve collaboration, coordination, and interdisciplinary and intersectoral efforts. As we heard from our colleague, Dr. Sara, that governance is one of the most important, and we found it in the first National Action Plan as some challenges in getting as we all know that AMR activities, multi-sectoral approach, different entities, animal, human, environmental is somehow challenging. So we found this objective that made our all the other objective work much more fluent, easily, and we had the interconnection between different sector. We also had strengthen the knowledge evidence base through surveillance research, and also improve awareness, understanding of AMR through effective communication, education, and training, optimizing the use of antimicrobial medicine in human and animal, and also infection prevention and control, effective sanitation, hygiene, and prevention measures. So these are the initiatives under each of the major 5 objective. We have 13 initiatives. We have under the governance, we have the govern the national committee efforts, govern the multi-sectoral AMR efforts, where we have different activities under each initiative. Also in the surveillance, to improve the national multi-sectoral surveillance, improve the laboratory capacity in human, as well as the animal and environmental laboratory capacity, and enhance and promote evidence-based research. And under the awareness, we have two different initiatives, which is increase the national public awareness, as well as include AMR in the and related topics in professional education and training certification. Optimizing the antimicrobial use, both the antimicrobial consumption in human and animals, as well as stewardship programs in healthcare facilities, and to ensure prudent use of antimicrobial in animal and agriculture. Infection control to strengthen the national infection control program in human health, and to establish national infection control in the animal health. These are some of the activities that have been already done during the 2024 under some of the initiatives. So under the surveillance, we had evaluate and define the national priority pathogen, expansion of the include other sectors, expansion of the human sentinel sites. Also under the consumption, we developed the database for human antimicrobial consumption on different levels, enrollment of the WHO class AMC, enhancement of the stewardship program, standardized the hospital and antimicrobial stewardship, as well as national monitoring and evaluation for stewardship programs in a different institution. Also in the animal, we established the National Center. There was an establishment of the National Center of Disease Prevention and Control in animal a couple of years ago. And also that enhanced the legislation of antimicrobial use in animal, and revise and update the list of prohibited and restricted antimicrobial animals, and monitoring on a yearly basis. I'll take you through the other part, which is the monitoring and evaluation of AMR, and how do we proceed with this monitoring and evaluation of multi-sectoral action plan. So as we included, as we have been talking about, one of the most important factor to monitor and evaluate the national action plan is to have a good governance of for antimicrobial resistance. So I'm just highlighting here how is the governance. We invested a lot in the governance of in general, and specifically for antimicrobial resistance. So we have on the ministerial level, we have different committees and different health and health policies that take place. Under that, we have the level of the board of directors, where we have the Public Health Authority, Saudi Food and Drug Authority, National Center of Prevention and Control of Animal Disease, where we have all the board of directors have multi-sectoral One Health approach. So we have all the representation from all around the sectors in each of board of directors. So that made it much more easier to implement the National Action Plan. On the level of the multi-sectoral AMR committee, which is a national committee that have the level of higher managerial, CEOs, executive director, to oversee the National Action Plan implementation. Under that, we develop working groups for operation. The working groups have different covering different aspects such as stewardship, surveillance, consumption, and we developed the working group based on the needs further. The steering committee of the AMR multi-sector started in 2017. We restructured the committee every 2 years. So since 2017, we had the fourth round of steering committee. In the latest steering committee restructure, we ensured more multi-sectoral representation. So we include more sectors that were not included with us before. We ensured the high-level decision maker representation, also to establishment of working group under the multi-sectoral operation for the operation of different aspects of the National Action Plan. We have 14 sectors with us, including human, animal, agriculture, environment, and food. And we have under these 14 sector, we have 17 members. We have allocated roles and responsibilities for each sectors when we develop the National Action Plan. So when we started developing the National Action Plan in 2022, we started the monitoring process define the activities as assigned sectors. So we have each activity under assigned each sector and in a specific timing, and we have a specific deliverable for each activity. So we do follow up the progress. We monitor the progress of predefined deliverables is being met in the timely manner, evaluating the quality of the output. So we do evaluate, we do monitor each activity based on the time, based on the sector, and based on the deliverable and the quality of the output that comes out of this activity. In terms of evaluation, we do a process evaluation, which is assessment of the deliverables of different activities in different sectors. This takes place in a quarterly base, and we have also another process evaluation at the end of each year, releasing yearly reports for multi-sectoral action plan, which is shared with all the sectors to make sure we have alignment between all sectors, as well as we develop corrective action for any delayed activities that come across the evaluation. In terms of midterm evaluation, we did in 2024 the evaluation of 2 years period of all assigned activities and their delivery to identify any challenges, and from that to improve the delivery until the end of the National Action Plan. And we are planning to also have an end of the action plan period evaluation to actually prepare for our updated plan and how can we overcome any challenges that happen during this round of the action plan. For the indicators, we have different sets of indicators. We have operational process indicators, and we have the outcome indicators as a part of M&E process. We have under the operational or the process indicator, we have 6 sets of data under around 16 KPIs that distributed between different aspects. We have the governance. We have under the governance, we have set of KPIs under the human health surveillance, where we follow up the process of the data collection, the data quality, and how can all these kind of things that we have couple of KPIs sets under the human health surveillance. Under the animal surveillance, also we established this to monitor the process of data for animal surveillance, the food surveillance as well, where we have sets of data to follow up with the AMR in food surveillance, as well as the antimicrobial residues in food. So all these aspects to actually define the progress of these areas based on the KPIs that we have set at the beginning of the National Action Plan, with the defined targets, as well as a yearly target that we each year we evaluate this target, and we see the progress based on the target that were set early during the establishment of the National Action Plan. Also, we have 2 different aspects where we have the indicators of stewardship and human, as well as stewardship and prudent use in animal. I didn't go through details of a set of KPIs, but these are the areas that we are covering in the process KPIs, as well as the deliverable and the outcome that we are the output of each activity that we are following closely. Lastly, in our monitoring and evaluation, we have the outcome KPIs, where we identify sets of KPIs that we are following and monitoring all over the period of the National Action Plan, where we have rate of Clostridium difficile, rate of E. coli, blood E. coli resistant third-generation cephalosporins, the two of the SDG, and also the methicillin-resistant Staph aureus in blood. Also, we have carbapenem-resistant Klebsiella and carbapenem-resistant E. coli. We have rate of carbapenem-resistant Pseudomonas and Acinetobacter-resistant to colistin specimen. Also, one of our outcome indicator is the consumption. So we developed the consumption on a different level in Saudi Arabia. We have consumption on a national level where we have the procurement and imported and local manufacturer antimicrobials, as well as the level of the hospital base, where we identify around 10 antimicrobials to be monitored on hospital level and outpatient. With that, I just want to highlight the importance of, I'm sure a lot of colleagues will be talking about this, importance of monitoring and evaluation of AMR action plan is to track the progress of performance of national action plan, implementation to address AMR, fulfill national, regional, global monitoring requirements to prioritize action, allocate resource appropriately, and the most important is to capture our lesson to correct our the course of action towards the country efforts to tackle AMR and learn from our experience and to improve our also activities in the upcoming national action plan. With that, I would like to thank you very much, and I hope I didn't take much time from my time. Thank you very much.
Thank you so much, Dr. Hiba. Always a pleasure to listen to you. And I totally agree with you on the point that good governance is required for the monitoring and evaluation. And I totally appreciate you and your team for making this happen. And there are only few countries in the EMRO region who have moved towards the development of the NAP2. And in these countries, they are focusing on the M&E frameworks and the targets. And Saudi Arabia is one of the countries. And that is why we really wanted to hear from you and listen from your experience. And I'm sure there are many participants over here. They will definitely learn and seek your expertise in developing their M&E frameworks. Thank you so much, Dr. Hiba.
Thank you.
And with this, we move to our next presenter for today, Dr. Emiliana Francis. She's a renowned microbiologist and a researcher, and she has done a number of contributions in the field of antimicrobial resistance. She is a national AMR coordinator at the Ministry of Health at Tanzania. And again, Tanzania is one of the countries who have moved towards the NAP2, and we would like to hear her experiences in developing the NAP2 and particularly on M&E frameworks. Thank you, Dr. Emiliana, for joining us, and floor is all yours. We can see the your slides, but we cannot
Sorry,
hear you.
can you see the slides?
Yeah, we can see the slides, yeah.
You can see?
Yes.
Okay. Thank you, Dr. Frenish, and thank you all members who have joined this call. My name is Emiliana Francis. I'm the National AMR Coordinator from Tanzania. I will pass you through the experience on NAP2, implementation on AMR, and the development of M&E framework. Tanzania, like many other countries in the world, they have a high burden of AMR. You can see we have a significant deaths from sepsis, significant deaths from bacterial infections, significant deaths from AMR resistance. In 2016, we conducted a situational analysis, but also a JEE, and these two reports they formed like a background information for us to develop the national action plan. So in 2017, we developed our first national action plan on AMR, and this national action plan on AMR lasts for 5 years. which was 2022. In 2023, we developed the second NAP, but the major gap in the development, in the implementation of the first NAP, it is that we didn't have the M&E framework to monitor the progress implementation of the National Action Plan. So when we wanted to develop the second NAP, we had to rely on the implementation gaps across sectors within the NAP, looking at the strategic objectives, what we have implemented and what we have not implemented, what was the gap, but also we had like a situational analysis on that, so that we came up with the recommendation to inform the development of the second NAP. But also we conducted the JEE, and the recommendation from the JEE also were used as a stepping stone in the development of, in the review of the second NAP, which we were able to review it in 2023. So this NAP were systematically costed using the WHO costing tool, had a private sector involvement, extension to subnational level, and also it has more multi-sectoral engagement. And this is the National Antimicrobial Resistance Governance Structure of Tanzania. We have the National Multi-Sectoral Coordination Committee. This is a centralized steering committee which is responsible for overseeing or coordinating all the activity or AMR activities in the country. This MCC is supported by 5 technical working groups, which is we have awareness and education, AMR surveillance, IPC, antimicrobial stewardship, and technical working group for monitoring and evaluation. I will take you through the key achievement of the NAP1 and NAP2. Tanzania had made a significant progress on the MR awareness and advocacy. We have the National MR campaign, which is in Swahili name Holela Holela Itakukosti, and this Holela Holela Itakukosti in English means that reckless use of antimicrobials is costing. So this campaign was one of the bigger campaign in African region, and this has been recognized by the African CDC MRN MAC report. When you read that report, you will see more about Holela Holela Itakukost. But also we have been able to define or to define AMR to translate AMR into our local language. So that the community, Tanzania is a Swahili speaker country, so most of the community members don't understand Swahili, don't understand the English, so we were able to translate AMR into the word uvida, usugu wa vimelea vya wagonjwa dhidi ya dawa. This is a Swahili word, so that when actually we are communicating AMR, so the community can understand what are we communicating. But also we have been able to do the high-level engagement on the AMR, engaging the ministers across sectors which are implementing AMR interventions. This is including establishment of AMR Parliamentarians Alliance, so that we bring the AMR issue into the politics, because everything is politics. So when these parliaments, they are going to the community to talk on their member on the issues of the politics, AMR can be one of them. So, and we know that the members from the community, they trust more the politician rather than the technical experts. So another key achievement on the implementation of NAP is on the AMR, AMU, and the AMC surveillance. We have made a significant achievement in strengthening of the lab system to inform national prescribing of antimicrobials, this including the capacity building in the Sentinel sites, but also we have been established the like 21 Sentinel sites in the country, 13 for human, 6 for animal and aquaculture, 1 for food safety, and 1 for environment. We have a remarkable progress on the antimicrobial stewardship program in the country from national level to the facility level. Like we are having 33 facilities which are actively implementing antimicrobial stewardship, and these facilities, they are acting like centers of excellence for other facilities to provide mentorship to other facilities which are a little coming to AMS program. This involving also the private facilities. Tanzania has been enrolled and they are submitting yearly data in the WHO GRAS. We are submitting the AMR surveillance data, but also the antimicrobial consumption data on yearly basis. We are also utilizing the AMR surveillance data to inform the review of the guideline at the national level. Apart from that, we are sharing at the regional, but we are also making the utilization of this data at a national level. For example, you can see we are collecting the AMC data for human, MC, AMR surveillance for human, for animal, and also for other sectors. But a good example here, from animal sector, we found that when we are doing the AMC surveillance in animal sector, we found that most of the antibiotics which are in human sector fall under the reserved group, like the polymyxin, the one which are extensively or the access used in animal sector. So we intervened this by establishing the national standard treatment guidelines for animal disease, and currently we are going on with the process of establishing the national essential medicine list for animal. This including the categorization of A, B, C, D list of antibiotics. But also we as you can see, we have a significant increase of AMR surveillance data. It's like 83% from when we started to submit to the GRAS. Up to now, the increase, it is like 83%. So we are improving very well in terms of AMR surveillance. But also we are using the AMR surveillance data to inform the review of the national standard treatment guidelines in the human sector. Recently, we have been able to develop or to review our national aware antibiotic categorization list by using our own data from AMR surveillance and AMC data. This was not in previous, because we had also the previous edition, which we used almost data from the research, and also we depended mostly on the recommendation from the WHO. But now we are having a lot of data so that they are informing the review of these crucial clinical guidelines in the country. The key findings from the AMR surveillance is that we are still facing high resistance to commonly used antibiotics. Like we are having the drug resistance index of 59.8. This is quite high compared to the recommended. We are also facing, the finding also show that there is a disparity of resistance rates by facility level and the location, increase the proportion of superbugs like ESBL, MRSA, VRA, and CRA. Another remarkable key achievement. This is on this comes from the joint external evaluation. When we conducted the first joint external evaluation, it is like we had no capacity in most of the AMR indicators, with the except of the healthcare associated infection prevention and control. But as you can see on the second JE, we had quite improved from the no capacity to at least sustainable capacity in some of the indicators, like multi-sectoral coordination on AMR surveillance, but also on the level 3, which is not bad when you compare to the previous one, which we scored 1. Now quickly I will take through on the development of the MNE framework. Tanzania has established an MNE framework. We are having a drafted document which is going to be endorsed on the next month. And this development of this MNE framework has included key components like establishment of a monitoring and evaluation technical working group. This one, we didn't have it in the previous implementation of the National Action Plan. So when we reviewed the second version, we established this monitoring and evaluation as a key technical working group for monitoring the progress of the implementation of the NAP. So also we considered the indicators and the target, how we set the indicators and the targets. During the setting of the indicator and the target, we defined the key performance indicators for 6 NAP strategic objectives. But also we had to review the recommendation from the second JE, the gaps and the recommendation, but also we had the recommendation from the PMP. This was conducted by FAO, Progressive Management Pathway. We had also some gaps and also some recommendation there. And also we have considered the 2024 UNGA meeting key actions and targets. So all these have been used to set our indicators and targets that will monitor the implementation of our National Action Plan. Another thing that we have considered is the data collection and the reporting mechanism. First of all, we considered the data collection tools. It's like every sector had its own data collection tool. Even within the sector, we find that we are having the data collection tools which are not similar. So we did the standardization, the harmonization of these tools, so that what we are collecting can be well reflected in our MNE framework. And also another thing, we consider the reporting mechanisms. We didn't come with a new reporting mechanism, rather than we just identified the available one and also making like the standardization. So we just look on the routine data reporting, like the DHIS2, looking at the different surveys conducted in different sectors, as well as integrated AMR and AMC surveillance platform across sectors. Another thing that we considered is on the multi-sectoral engagement, like the line ministries which are implementing AMR, research institution, and partners. Another component that we have considered in our MNE framework is on periodic assessment and adjustment. For this one, we just looked at how do we conduct the midterm and the end term, what time we conduct the midterm and the end term. Since we started the implementation of the NAP AMR in 2023, so our midterm evaluation will be on this year, 2025, December. So this is when we are going to conduct the midterm. and also the tools for conducting the midterms and end term, they have also been developed. But also we are going to conduct our NAP ends on 2028. So we are going to conduct the end term review on 2028. This was the internal assessment, but also we considered the external assessments like external periodic assessments and adjustment like the track survey, joint external evaluation, and the progressive maintenance pathway. Despite of progress, Tanzania faces challenges such as limited funding, weak enforcement of regulations, and gaps in data integration across sectors. Our future effort is focusing on the funding, expanding surveillance, strengthening governance, and ensuring sustainable financing. Thank you. I submit.
Thank you so much, Dr. Francis. It is just good to listen all the good work that Tanzania has done. And I'm really happy to see the efforts on the MNE framework in particular. So this is the thing we really wanted to listen, that countries, they are working and struggling. And your last slide is like kind of a point of discussion for our experts as well, that the funding will be required to make the thing sustainable, to make the thing implementable. So we totally appreciate all your good work and efforts. And we look forward to have you in our panel discussion as well if we have some questions for you. Thank you so much for your time. And with this, I move towards our next presenter for today, Dr. Tochi Okwar. Dr. Francis, I request if you can stop sharing your screen so that the next presenter can share the screen. Yes, okay. So next we have Dr. Tochi with us. She is instrumental in the field of infection prevention and control. She is the Infection Prevention Control Program Coordinator, Chair for the Nigeria AMR Coordination Committee, and she is the Head Department of Disease Prevention and Health Promotion from the Nigeria Center for Disease Control and Prevention. Thank you, Dr. Tochi, for joining us today. And the floor is all yours for your presentation on Nigeria's National Action Plan and Monitoring and Evaluation Framework.
Okay, thank you. Can you see my screen?
Yeah, we can see the screen. Thank you so much.
I'm seeing myself. Let me see how to. Okay. All right. Thank you. Let me start by thanking the organizers for inviting me to share our experience in trying to work out the best way to address M&E issues in our National Action Plan. My name is Tochi Okwar. As been said, I chair Nigeria's Antimicrobial Resistance Coordinating Committee. I'll start by just giving an idea of the complex nature of Nigeria and our AMR governance structure, then quickly dive into our first National Action Plan, subsequently our second National Action Plan, and our efforts at M&E and tracking progress. So what I've tried to bring out here are some key socio-demographic factors that I consider are relevant in understanding Nigeria as it relates to the enormity of our AMR response and the things that we need to contend with. We have a population of over 220 million people, and when we look at the urban-rural dichotomy, it's fairly distributed, 53% urban and 47% rural. There's a high burden of infectious diseases. We have a high burden of malaria, TB, HIV, diarrheal diseases, and respiratory infection. And then you look at the health system and the infrastructure. The doctor-patient ratio is put at about one doctor per 5,000 population. And compare this to the WHO recommendation of 1 per 600. There's a high self-medication and use of over-the-counter sales of antibiotics. When we look at how healthcare is paid for, there's 60% reliance on out-of-pocket payment for healthcare. On the animal and livestock side, the information we have shows that we have over 200 million cattle, poultry, and aquaculture and there's a huge aquaculture industry. On the socioeconomic and policy landscape, you have low literacy level, particularly as it relates to health education, low literacy around the issues around use and misuse of antimicrobial resistance. However, since 2017, we have had a national action plan guiding the efforts at combating antimicrobial resistance. And the governance structure we have for addressing antimicrobial resistance in Nigeria shows that it extends from what we call the operational level, AMR technical working group, that is broken down into pillars. These pillars are across sectors, and across sectors we mean the animal, that's the livestock, the human, the environment, the plant health, and we've also incorporated the water resources. So each of these pillars at the base, at the level of the technical working group, have representation from all the relevant sectors, civil society organizations, people affected by antimicrobial resistance. So it's a multi-sectoral whole of society sort of representation at that level. And the central coordinating body for antimicrobial resistance is actually at the AMRCC, the Antimicrobial Resistance Coordination Committee level. That's also where the National AMR Secretariat resides. And that AMR National Secretariat is at the Nigeria Center for Disease Control and Prevention. But what is also important to note here is that this structure goes all the way to the presidency. And currently now the AMRCC is expected to provide regular updates to the presidency. And this governance structure has been approved by the highest health body in the country, which is the National Council on Health. Same structure is also reflected at the subnational level. Nigeria is a federating entity. We have the federal government and also 36 states, with the Federal Capital Territory constituting the 37th entity. So our target now is to ensure that this governance framework is established and functional by 2028 across all the states and the Federal Capital Territory. I had mentioned that our first National Action Plan was developed in 2017. It ran from 2017 to 2022. And like other countries experiencing their first National Action Plan, we didn't have a lot of capacity. We didn't have a lot of baseline information to really put together a well-customized bespoke for our needs. And the major thing missing there was that really was no monitoring and evaluation framework. However, as we got to the end of that National Action Plan, we took time to assess how we fared in our first National Action Plan. And some things that came out clearly, respect to what worked, was the strengthened coordination. Clearly, we had done well in the National AMR Coordinating Mechanism. There was robust stakeholder engagement that included government, academia, civil society, and partners. On the area of awareness, we did well, fairly well, particularly in the area of World Antimicrobial Awareness Week across sectors. But in making awareness something that wasn't just doing World Awareness Week, we had challenges, and also there were challenges with tracking what sort of impact this, or measuring or monitoring how the effect that these awareness activities we are having. Another thing that worked was the establishment of a national AMR surveillance network, particularly in the human health sector, where we set up our Sentinel system. Then IPC programs are initiated in the Orange, in our national IPC program, Turn Nigeria Orange. And there were also national AMR surveillance strategy and drug distribution guidelines, amongst other things. But I think for the purposes of this discussion, what is even more important is what we found out that didn't work very well. It was that we had inadequate, often non-existent domestic funding, and there was huge donor dependency. And I'm seeing here that I've highlighted weak M&E system. In fact, in that first National Action Plan, there was no M&E framework as at the time it was designed. There was also poor integration of animal and environmental sectors, even though there was a lot of progress made in these two sectors. during the implementation of that NAP, First National Action Plan. And then there was uncontrolled antimicrobial access and use still there, and inconsistent and fragmented antimicrobial resistant data. Another thing that jumped out was the capacity and implementation gaps. There was limited trained personnel. The country, we found that, had issues with attrition of workers. You train epidemiologists, they get employed, they leave the country. You train clinical microbiologists, you train people who work in the lab, and immediately you train them, you make them attractive to be poached. There was also underperformance in community outreach and rural health inclusion. We found that we hadn't really done a great job of bringing in those that operate at the primary healthcare level, and our subnational implementation lagged significantly. So these were the major things we found out when we assessed our First National Action Plan. And it fed into and informed how we went about developing our Second National Action Plan. So in the development of our Second National Action Plan, we leveraged the strength we had, which was a multi-sectorial One Health nature of our coordinating mechanism. We continued in that vein and developed our National Action Plan 2.0 through a multi-sectorial One Health framework. We tried as much as possible to ensure that that process was evidence-informed. We did a comprehensive situational analysis. We factored in the evaluation of our First National Action Plan, the joint external evaluation, how we fared in our National Action Plan for health security, and any other place we could get the information we needed to be sure that we're getting a good picture to inform what we needed to do. In terms of scope and ambition, all activities were costed and mapped to indicators, and we tried as much as possible to align them with global and national strategic frameworks. This is what we ended up with, National Action Plan 2.0, where we had 6 focus areas. And you'll notice that we have a governance focus area. One of the things that came out when we realized that we couldn't do M&E, we couldn't track things, it was really, while we had a coordinating mechanism for One Health, but with respect to tracking things and being on top of the National Action Plan itself, we realized that we needed to strengthen leadership, the collaboration, the structures at all levels. So we did introduce a strategic objective, a pillar, the governance. Then we have the awareness and the education, the surveillance, the infection prevention and control, biosecurity and vaccination, including access to WASH, all across the One Health sectors. And then the stewardship and research and development, where we're aiming to build knowledge and capacity of relevant stakeholders to improve local innovations, research and development in antimicrobials, diagnostics, and vaccines. In total, what we see we have in our Second National Action Plan are 6 strategic objectives, 4 interventions, and then we broke them down into really activities and sub-activities. So 143 activities and over 450 sub-activities. And with the support of WHO, we had a series of workshops where we took time to budget, to cost, and have discussions around how to get the budget to implement the Second National Action Plan. The total that we arrived at was a National Action Plan over 5 years of a very conservative budget of just under $78 million US. And this is broken down across the different strategic objectives. We also went further to distribute this cost across the lead agencies and implementation and implementers. We also further went to break it down into what are the cost implications year by year. I show here the extensive stakeholder engagement, and I'm putting here before I go to the M&E framework, in order to really get the costing, ensure that the objectives speak to the real needs, and that all the information and decisions that resulted in this National Action Plan and the objectives, we had to engage nearly 140 stakeholders over a series of workshops. But it gives us confidence now that we have really brought as many stakeholders as we can reach at this moment in the on the table and got buy-in and ownership. So for the monitoring and evaluation framework, what we aimed is to embed M&E, having learned from the first National Action Plan, we aimed to embed M&E from the outset in our second National Action Plan, and we relied a lot on WHO guidance, and we really are grateful for the way we worked with the quadripartite, with WHO, with FAO, World Organization for Animal Health, and even UNEP, even though they're not in country, WHO helped us to bring them on board. So we wanted to develop something that will enable real-time learning, that will enable accountability and give us the leverage to course correct on time and not just wait for the end and realize that we just didn't do too well. There was also this dual focus of monitoring. We want to be tracking the 140-something activities we have, track the inputs, track the process, track the outputs, and then the evaluation to assess the outcome and the impact. In terms of the evaluation design, I can see that almost every other country that's presented here have done. We have planned for the midterm internal evaluation and the end term external evaluation. So just to show how some of the things we have one impact we are aiming for, and that impact builds from some of our commitments from SDG commitments. As at the time we were developing this, the United Nations General Assembly commitments had not come out, but we had the Muscat Declaration, where there was the aiming for 60% aware access group of antibiotics, and then the reduction of critically important antimicrobial use in agriculture. So for impact, we aimed for to have the prevalence of antimicrobial resistance across human health, animal, and environment to be significantly reduced, thereby enhancing public health security, promoting sustainable agricultural practices, and preserving ecological integrity. And then you can see the key performance indicators we worked out to help us to track our progress there. We then had 6 outcomes, which you can see here, from strengthening governance and collaboration to improving awareness all the way. So these 6 outcomes followed the 6 strategic objectives that we had, and each of these had key performance indicators that we extracted. And we then went further to break them down into, so what will be these indicators and what agency will be responsible for providing this information? What is our baseline? What's the benchmark for measuring this? And from a practical perspective, this was where we found the part we found most difficult. How do you set targets? What are your targets? And we then realized we needed to do a lot of baseline. We needed to establish a lot of baseline. As I wrap up, I'd like to show how we try to align our M&E framework with the WHO recommendation. So you see, WHO recommends that we define the audience and the users of the M&E. We worked to make sure that we engaged our One Health stakeholders and define them in our M&E framework. Who owns this task? From who will give us this information, and who will deliver on this? And how do we make this your agency or your try to mirror. Okay, so finally, national action. Can you hear me? Did you lose me?
Yeah, we can hear you. Yeah.
Okay, so but you got what I said about mirroring our framework.
Yes.
The process for that, we tried to mirror our framework to mirror what WHO recommends. And we then realized that we had a lot of activities and we needed real-time tracking of these activities. So we have developed a national action tracker. This will ensure transparency, accountability, and adaptive management. What we have done here is an application where we have loaded the whole 143 activities there with all the agencies. And at every AMR coordinating technical working group meeting, at the end of every meeting, this is updated. Phone calls are made, verifiables the things to verify that they've been done are there, and we use them to look at progress visualization. So the dashboard displays sectoral performance. There are also inbuilt alerts that highlight overdue activities or budget discrepancies. And we are working to make this accessible through MDAs. And then this monitoring, this way we can closely monitor the implementation of all the activities outlined in our first National Action Plan. And how do we then use all this M&E information we are getting? Remember, I've shown this structure at the beginning. After we've discussed this and looked at how we are doing at the level of the technical working group, is presented to the AMRCC and some strategic decisions are taken with them. We discuss, so why are things not working? What's working well, not what's working well? We actually then summarize our findings and take our report to the National One Health Technical Working Committee, all the way to the National One Health Steering Committee to show the progress we are making. But even more importantly, we then present to these higher level authorities the challenges we are having. For instance, we're having power challenges in hospitals. Would recommend that the Minister for Health please have a meeting with the Minister of Power to take care of some power issues going on in teaching hospitals. So we take those, all the M&E feedback we are getting and feed it.
Dr. Tochi, we are not able to hear you.
To have clear roles for all stakeholders, it is key for accountability. Keep it simple, avoid overwhelming the existing system. Anything that can feed into an existing system, please retain it there. Use existing data systems and proxy indicators where possible. And budget for the M&E activities. Have a dedicated group working on this. For us now, the M&E function now resides with the governance pillar of our AMR coordinating committee. And you can't do this without skilled personnel across all the sectors. So capacity building is critical. As I end, I would like to inform the House that Nigeria will be hosting the 2026 High-Level Ministerial Conference on Antimicrobial Resistance. And we will continue to socialize, and we welcome everybody to come share ideas with us and begin to plan to be in Nigeria in 2026. Thank you very much.
Thank you so much, Dr. Tochi, for a very detailed and excellent presentation on the current work on the National Action Plan. And we totally appreciate the excellent work on the M&E framework. And this is the thing that we really wanted to hear. It is an excellent approach, the stepwise approach, and the key takeaways, they are really an eye-opener for all the countries and the participants who are listening to your presentations. And we look forward to have a very good meeting in the next ministerial meeting in Nigeria. Thank you so much. And we will now move towards our next presentation for today. We are going to have Dr. Pravarsha Prakash with us. She is the Technical Officer Monitoring and Evaluation at AMR Division at WHO Geneva. And she supports the WHO efforts in monitoring and reporting on AMR, and she's been supporting a number of countries. She manages the track system, which is administered by WHO along with FAO, WOH, and UNEP. Thank you, Dr. Pravarsha, for joining us today, and it will be a pleasure to listen and learn from your experience on M&E frameworks.
Thank you, and good afternoon and good evening, good morning, everyone. Thank you so much for this opportunity. I hope you can see my screen. Is that okay?
Yeah, now it's all good. Thank you so much. Thank you.
I'll try to be brief because actually I think in the end the presentations from our three previous speakers covered pretty much everything that I'm going to talk about, but in a much more practical way. And it's really been great for me to listen and hear from your experiences. So I will share the presentation at the end of it, which will go into details, but I think some of it might be repetitive, but I think it's great to see how theory and practicality actually meets as well. So I will just cover broadly the global framework for AMR and then go into why M&E is important for national action plans and how countries can go about developing an M&E system for it. And just a reminder that when the Global Action Plan was adopted in 2015, countries agreed to implement, firstly, develop, implement, and monitor, very importantly, their national action plans on AMR. And to support these efforts, the tripartite at the time, so WHO, FAO, and WOA, developed a global M&E framework for the Global Action Plan to monitor global progress on the actions taken to counter AMR. And as part of this monitoring effort is also the Tracking AMR Country Self-Assessment Survey, or TRACS, which I hope many of you are involved in or at least are aware of, which is meant to monitor the implementation of national action plans. And we've had about 8 rounds completed thus far, and you should also be expecting the 9th round to be launched in April. So you will be hearing from us soon on that as well. Sarah already went through this, and just to highlight that only about 28% of countries reported to actually having any monitoring in place for their national action plans. So it's really an area that needs a lot more efforts in at the country level, so in terms of their national action plan implementation. So just to summarize quickly the monitoring and evaluation framework for the Global Action Plan. It is basically a system that was meant to facilitate the generation, collection, and analysis of data to assess the success of the Global Action Plan, and very importantly, to inform operational and strategic decision-making on AMR. It includes a recommended list of indicators, and it was great to see that many of the countries who presented today have incorporated some of these indicators. And the indicators are meant to be compiled at the country level through primary data collection systems such as GLASS, the WOA Global Antimicrobial Use system, or even TRACS, but also indicators are already available at the global level and are from secondary sources such as SDG reporting or the global estimates of immunization coverage, etc. So we have made about 22 outcome indicator recommendations and also indicators at the output level. And additionally, we've also included some supplementary indicators that that countries can take into consideration as well. And the indicators and the framework, just to remind everyone, are across all the sectors as well. So it is a joint multi-sector framework. And I think this is really important to now just look at the results chain, because I think this guides really the whole work that is done at the global level in terms of monitoring, but also should really reflect what's being done at the national level as well, because national action plans in the end need to look at what are the causal pathways that connect all the inputs and activities that go into the national action plan and what they lead to in terms of outcomes. And in the global M&E framework, these outcomes reflect basically the 5 objectives of the Global Action Plan, leading to the goal of being able to continually treat infectious with effective and safe medicines, and also to reduce the, of course, the burden of infections overall as well. To remind everyone and give you an overview of the targets that were outlined in the UN General Assembly Political Declaration that was adopted last year. And I was very happy to see that Tanzania has already included a lot of these targets. But a reminder for others that there are targets in the UNGA Declaration that cover multi-sectorally governance, but also specific to human health, agriculture, animal health, and the environment. And the overall target is to reduce AMR-related deaths by 10% by 2030, but also there are targets on financing for AMR, access, WASH in healthcare facilities, and also just in terms of M&E response or participation in the TRACS survey as well has been set to 95% country participation. I will just go into why M&E is important, but Dr. Heba has also already covered it, but maybe just to talk about broadly when we talk about monitoring and evaluation, what is the difference? And just a reminder that, of course, monitoring and evaluation are very interdependent, but they're not the same. So while monitoring is more concerned with recording of activities and achievement of results, evaluation, of course, goes further, and it's a more objective, systematic assessment of a upcoming, ongoing, or completed program or project. So why is AMR for national action plans important? So it is really important to have a well-established M&E system so that we can track progress, prioritize actions, allocate resources appropriately, and also, I think, like many of the speakers mentioned earlier, to capture lessons to correct the course of action towards the country's efforts to tackle AMR. The M&E plan should be an integral part of the National Action Plan, and its development and implementation really should be considered as key components of the National Action Plan life cycle. And like Dr. Tochi mentioned, it's really important that M&E, especially for those countries who are in the process of revising and developing a new National Action Plan, then please do consider monitoring an integral part of the National Action Plan design, that it's not something that comes after, but really something you incorporate as you develop and design your National Action Plan from the start. So when we talk about how actually countries can go about developing the plans, we've of course heard great examples of how countries have developed it. Just a few guiding principles to keep in mind when you're developing your NAPs. Remember to make sure that the M&E plan, like the National Action Plan, needs to be multi-sectoral in nature to reflect the multi-sector nature of the National Action Plan, of course. As much as possible, the workload that is required to collect data for key indicators at the local and national levels should be optimized. So data collection processes should be simple, feasible, and sustainable. It's also very important. We saw as examples previously how important is governance. So please do ensure that you think of resources for the M&E function and making sure that there are clear terms of references for the M&E group or focal point, and if possible, even set up an M&E sub-working group or technical group within your governance sectors so that there's real allocation of resources, but also accountability and responsibilities assigned as well. And then very importantly, it's important to institutionalize the AMR M&E functions so that we can ensure sustainability and really build country capacities that can also go beyond AMR as well. Also, just to highlight some considerations for countries when developing an M&E plan. So make sure really to tailor plans to the country context and priorities. Even though I mentioned that the global M&E framework has many indicators that we recommend, make sure that still it's the indicators you choose, the data collection system, the reporting frequency, etc., is really contextualized to the country capacities and priorities as well. And so you have really think of why do you need M&E, who's going to do it, but try to really tailor it to the country context. Also, like I mentioned earlier, really think of who is responsible for data collection and analysis, and if there are adequate resources as well available for that. And we are very aware that countries are at different stages of implementation and capacities. And so it is important to make sure that the M&E plan reflects these differing technical capacities and resource availabilities as well within countries. I think it was already mentioned, Dr. Tochi really highlighted and gave you a very practical example of the 8 steps that we, WHO, but also because this is a joint quadripartite effort, so we recommend 8 steps, and I will not go into details of it, but I'm happy to share my presentation. But I think Dr. Tochi already walked us through these 8 steps, and it's really something for you to keep in mind when developing your M&E plan. You don't need to follow the order, but I think it gives you a clear framework really when you're looking at developing your M&E plan and having a checklist in terms of what needs to be in place. And then it ends, of course, with having a real idea of how you will evaluate your plan as well, so that lessons learned from your data that you're getting are actually used in maybe changing or tweaking your operational plan, or if you're revising your national action plan to make sure that the data that the M&E system really collects is used for decision making. This is the results chain that you can use for national action plans, of course. So think of all the inputs and activities, and generally this will go into your operational plan, which will help you measure the effectiveness and efficiency of your work. And then the outputs and outcomes, impact, etc., will really help key decision makers assess the impact of your actions and to make sure that the ultimate beneficiaries are actually served when it comes to your program implementation. I wanted to also just give you an example of a plan from Kenya that they developed, and just to highlight that they have really used these the results chain thinking of having a goal, defining their key outcomes. And so they have 5 objectives as well. And what are the different outputs that go into it, and an indicator for each level. And they have developed this for different sectors very similarly. So this is an example for the human health sector, but they have one for the animal health and crop sector results framework as well. And again, I think that's it, just to remind everyone, we do have resources and we're here to support. So WHO, like Sarah mentioned, has the implementation handbook. That can be a really useful tool if you're revising your national action plan currently. So just giving you the steps to consider, and more specifically on AMR, on M&E, sorry, a reminder that we do have a quadripartite publication, which is guidance to facilitate M&E for national action plans. And you can also take an e-learning course on the same, which, if you find it more useful, it is available on the WHO Academy, and the links are available here. And again, a reminder that if you're developing indicators, please do look at sources where that are already existing. So don't forget that many countries, we had about 95% of countries responding to tracks. And so that's it in itself is a very useful source of indicators at the country level. So really think of using and building indicators that already exist as part of your M&E plan, and not to reinvent the wheel when it's not necessary. Thank you again very much.
Thank you so much, Praversha. I am really happy to see all this good work. But the best thing is that all the hard work and all the documents and trainings that WHO and other quadripartite they have done, we can see the outcomes now with the countries. And this is the best thing, that gradually the countries are thinking and moving towards this M&E frameworks. And this is a thing that is needed. And I totally agree with you that while developing the M&E frameworks, the indicators should be considered very seriously, so that we have to be answerable to some of the targets. So thank you so much for all your good work, and we appreciate your time and time with us, and we look forward to have you in the future as well. Thank you so much. And with this, we move to our last part of our workshop for today. This is going to be a panel discussion, and we have 3 panelists with us today, and I'm really happy to introduce all 3 of them. We have Dr. Peter Howitt. He is the Managing Director for the Center for Health Policy and Climate Care Center at the Institute for Global Health Innovation. And he also provides a managerial support for the patient safety research collaboration, and leads the policy workstream for the Fleming Initiative. And he's from the Imperial College London. Thank you, Dr. Peter Howitt. Next, we have Dr. Muwapu Nadahi. She is a veterinarian, and she is working in the Federal Ministry of Livestock Development in Nigeria. and she is one of the active member of the National AMRCC and a Fleming Fund Fellow for the antimicrobial consumption. And we have Dr. Peter. Dr. Peter is a public health expert, and he's a health diplomat with extensive experience in AMR and global health security. And currently he serves on the GHSA AMR Action Package Uganda Secretariat, and he is an epidemic intelligence analyst at the Ministry of Health at Uganda. Thank you all the panelists for joining us for today. And we can move towards our questions with all of you. So I can begin with Dr. Peter. Dr. Peter, are you there with us?
There are two Peters, I think.
Yeah,
You need to
Dr. Peter
specify.
Howitt. I think we can go with Dr. Peter Howitt. I think we are running out of time, so he has just mentioned to ask the question to him first. Yeah, Peter is here.
Yes, I'm
Yes,
here.
Dr. Peter, thank you. So Dr. Peter, you have a huge experience in the field of support in the system thinking, and we would like to hear from you that what incentives can be introduced to encourage the compliance with the National Action Plan's AMR guidelines and regulations.
Thank you very much, Afrinish. Let me just share. I've just got one slide.
Sure.
Hopefully, can you see that okay?
Yeah, we can see it well. Yeah.
Excellent. So for this, with the work of the Fleming Initiative, what we're really trying to do is go beyond the sort of traditional science to think about different ways of tackling antimicrobial resistance. And a key part of that is behavioral science. This framework, the EAST framework developed by the Behavioral Insight team, is a way of thinking about the incentives that you can bring in to your national action plans to encourage compliance. So just talk through each of the four elements. So the E stands for easy, and this is recognizing that as people, we all want to go with the flow, do the follow the path of least resistance. So an example might be if we're all looking to increase the share of antibiotics from the access group. If you pre-populate digital forms and systems that come up when it's indicated antibiotics and need to be prescribed, if you make that easy for clinicians, then they're likely to go with the recommended antibiotic and prescribe that. Attractive is all about how you frame the problem. And there's some really good resources from the Wellcome Trust looking at how we communicate on antimicrobial resistance. And what they've found is the best way of framing the issue is about how AMR can really undermine modern medicine and take away the health gains we've had over the last century. So that's a powerful way of getting this issue across to people and helping people realize why tackling AMR is so important. The social, S for social, reflects that we're all social animals, and we respond to the social environment around us, including sort of social norms and benchmarks. So an example from the UK is we sent letters to the 20% of doctors who had the highest rates of prescribing antibiotics and said, kind of, are you aware that you're in this sort of top 20% prescribing a lot more than average? And we saw a significant decrease in prescribing once people were aware they were an outlier. And then finally, timely. So really important to think about how we encourage immediate action and make things relevant. I know there's been a lot of discussion about how AMR could be a big problem by 2050, etc. But there are already nearly 5 million deaths associated with AMR now, and we need to present it very much as a current problem to deal with, not one of the future, because if it's seen as too future, people kind of discount it and focus on the many other urgent issues that exist today. So recommend the EAST framework as something to think about with your NAPs in order to encourage compliance. I'm going to stop sharing and hand back to Afrinish. Thank you.
Thank you, Dr. Peter, and such an interesting approach and a simpler approach to the issue of AMR. And I totally agree with you that the world needs to listen something very simple, very technical terms. They are not going to help anymore. And the world is moving towards various approaches like this, like we have seen the people-centered approach. And thank you for all the good work. And we look forward to your great initiatives and support for the AMR. Thank you so much. And now we can move towards Dr. Peter, and then other Peter, the Dr. Peter Ahabbi. And yeah, the question for you is that what should be the key MNE targets for the National Action Plan on AMR, and how can we ensure their implementation? And do you think that these targets, they should be in line with the gap? And we would also look forward to hear your thoughts on the accountability among the stakeholders.
Yeah, thank you so much. Can you hear me?
Yeah, we can hear you well.
Yeah. So one of the things that I think was very important at the beginning of this fight was that at the very highest levels of global governance, we had this UN level kind of action. We had the formation of the tripartite. And for countries to move forward, even though it's hard, there needs to be an active move, and many of the presentations have given proposals for how this should be done. But we should avoid the cowboy mentality that I'm going to go into a country, I'll pick one ministry to work with, and then try to see if I can make progress. Because in the end, you're going to have health far outpacing agriculture, wildlife, environment, and then that is counterproductive. I think we need to keep putting on the pressure to have these strong governance structures that are coordinated. Number two, for sustainability of AMR action plans, we shouldn't seek to establish new funding mechanisms or new funding structures. But for example, we should try as much as possible to embed these targets within existing government programs and ministries, with the hope that either they can increase the budgetary allowance within those program areas, or at least divert from some less critical areas. But it's a lot easier to get more money for an already existing program than to start creating whole new funding streams and whole new funding in the agencies. Of course, one of the big issues remains, how do you share money across different government ministries? That's why the idea of setting up a one AMR fund and then going into the politics of dividing it becomes challenging. But if every ministry identifies focal points and programs already part of theirs, then it's easier to deal with the sustainability of the interventions. I'll stop there for now.
Thank you, Dr. Peter, and I totally agree with you on your thoughts. And we can have a question for Dr. Mwapu Nadahi. We would like to hear from your thoughts that what are the key performance indicators that should be used to measure the progress towards NAP AMR goals, particularly in the AMR sector. And next, can you also share some thoughts that how can we ensure the long-term sustainability in the NAP AMR implementation?
Okay, thank you so much. Can you hear me?
Yes, we can hear you.
Okay, so your question around key performance indicators, as clearly stated by Dr. Tochi, we have drafted our M&E framework in the National Action Plan, which is validated. And I looked at some key performance indicators, especially in the animal health sector, and one of which is to know the percentage of farmers that are reporting improvement in their behavior towards prudent use of antimicrobials as a result of awareness creation, based on the surveys that are conducted. Most times we implement activities, but it is not enough to just implement, but then to measure the impact of those activities using the KPIs. Another activity is understanding also the proportion of maybe sentinel sites within the sectors that are reporting data on regular basis, and then proportion of maybe improvement in data quality assurance and percentage improvement in DQA scores, in the sites, in the sentinel sites. Then understanding the number of laboratories that carry out susceptibility testing using standard protocols, as highlighted in the NAP, maybe proportion of farms that comply with standard biosecurity measures, and then improvement in percentage vaccination coverage in humans and animals when in terms of IPC, number of maybe registered hospitals with AMS programs and so on. These are some of the key performance indicators that we can look out for vis-a-vis the activities that we already have in our national action plans. Then to your second questions around sustainability, Peter has already mentioned some, of which is really important to integrate AMR activities into existing national programs. For example, vaccination programs that are ongoing in the livestock sector, immunization programs, that will support the IPC pillar activities. Other programs could be maybe national TB programs that will support AMR surveillance data, and even disease prevention, national disease outbreak investigations that will provide data on pathogens that cause outbreaks, as well as their susceptibility patterns. We can also leverage, for example, in country, what we say is that most of the sentinel sites that are already existing and generating AMR data, is there a way that they can just maybe charge a token fee for the susceptibility tests that are carried out? And those funds can be used to restock consumables to ensure that those sites continuously report data on AMR from the human health, from the animal health sector as well. And as rightly stated by Peter, we don't have to create new budget lines, but then leverage on annual budgets that government already have. Can we include AMR activities in our annual budgets such that when fundings come, they will be allocated for AMR interventions? Thank you.
Thank you so much, Dr. Mwabu, and it's great learning, and you have huge experience in the field of AMR, so I totally agree with all the points. And I'm really thankful to all my panelist speakers for joining us today. And now I hand over to Dr. Viviana Muniz. She is the head program at the South Center Geneva, and she has been instrumental in the field of AMR for quite a long time and supporting all the LMICs in the work of AMR. And this is her idea of discussing at this time about the monitoring and evaluation on AMR. So I hand over to her for her to summarize the whole workshop and her thoughts on the M&E frameworks. Thank you, Dr. Viviana, for joining. Yes.
Thank you so much, Afrinish. And of course, a summary would be a very difficult job. But to everyone, first of all, thank you so much for all your inputs. We've learned so much from the WHO explanations, hopefully all the listeners as well. And this will be recorded and shared so that you can, in your own time, follow a lot of that guidance and look through the presentations. We've also had wonderful presentations on the national action plans and how monitoring and evaluation has become an important component of them. So congratulations for our AMR leaders that we've heard today from the Global South. And also, of course, we've heard that M&E is a challenge, that there are difficulties in keeping the capacities that are necessary to have both the human resources for the continuous work that requires the data gathering, analysis, as well as keeping all programs in check and wanting to create a culture of evaluation and of reporting. So of the incentive system that allows to view this not just as a task, but as learning, and that helps overall the process of better implementation. I'd like to also take a note of the panel, which has been very helpful in indicating additional elements for progress on monitoring and evaluation. We also heard, and I just recall from our colleague from Tanzania, Milena, who mentioned the joint evaluation exercise. And just to note that these exercises also monitoring evaluation, which are under other international health instruments, such as the international health regulations, that shows that those processes can also be helpful to guide what our understanding of the gaps that we have on AMR at country level. So also to use resources from those other processes. So that's the JEE mentioned, the joint evaluation that many countries have done as part of their national health security national action plans, as those are 5-year plans and they're under the purview of the international health regulation implementation, which is actually for now one of the key binding international instruments on health. So that linkage is quite interesting to see that AMR has been identified as a priority where there's many gaps at country level as part of the JEE exercises and as core capacities of the international health regulations. So with that, I'd also like to just thank Afrinish. You've done an excellent job today in helping moderate. I think perhaps we had so much great material and great presenters that of course the recording will be so much more helpful for everyone to be able to digest everything that's been discussed today. So thank you all so much, and we hope that you'll continue to participate in South Center webinars, and to all those participating again, we look forward to continued collaboration with you. Thank you so much.
Thank you. Thank you, everyone.
Thank you, everyone. Bye-bye.
Bye-bye.